Good afternoon, everyone. Hello, I hope your Wednesday is going well. My name is Addie McClellan. I'm the Community Engagement Manager for United 10 Homelessness. And I'm sure you're used to seeing Bex Hayho as your host or on the screen instead of me, but I will be filling in for our Executive Director for this chat. So last month was Hunger and Homelessness Awareness Week, and we had two great virtual events that happened during that week. We had the State of Homelessness address, and then we had a community chat called Passing the Mic that was with the members of the Orange County Continuum of Care Lived Experience Advisory Committee. So if you missed that chat or the State of Homelessness address, you can find both of those recordings on our YouTube page or our Facebook page. And I highly recommend checking them out. They're great. They were great events, and we're so excited that we had all those guest speakers participate in the Awareness Week. And now we are in November, and with the nights getting colder and the holidays right around the corner, this is definitely a very important time of year to talk about what is a very important topic about health and homelessness. So to help us with this topic, we have two national experts. I am personally very excited. Our team is very excited to have these two guests on our community chat. We have Dr. Kelly Doran, the assistant professor at the Departments of Emergency Medicine and Population Health at the New York University School of Medicine. And we have Bobby Watts, the Chief Executive Officer of the National Healthcare for the Homeless Council. So thank you so much, Kelly and Bobby, for joining us today. We're so excited to have you both on and for you to take time out of your busy schedules to join us. So to kick us off, I will pass it to both of you to tell us more about yourselves, to introduce yourselves and tell us about the work that we do. So Kelly, I will pass off the mic to you to tell us all about what you do.
Great, and thank you, Addie, for hosting this event and for inviting me. I'm really excited to be here. So as Addie mentioned, my name is Kelly Doran. I am an emergency physician, first and foremost. I work in an emergency department in New York City, a public emergency department where around 15% of our patients at any given time are homeless. So you can find me there. Usually one weekend night a week is when I'm in the emergency department, and the rest of my time I spend doing research related to homelessness, including the intersection of homelessness with substance use and overdose, as well as what we can do from the healthcare system to better help for our patients who are experiencing homelessness and ultimately connect people with housing. And then a last piece of my work is around advocacy and trying to educate other healthcare providers around homelessness and how it affects health. We have a new Health by Housing lab in the Department of Population Health at NYU School of Medicine that I'm pretty excited about. And I have to just take like 30 seconds to say that I'm so excited to be here today, especially with Bobby Watts, who has been a role model of mine for some time. And I just have to share that, I've been interested in homelessness ever since undergrad. I've been doing work related to homelessness, but when I was in my fellowship, I got connected by one of my professors with Bobby. And Bobby has never been anything other than kind in every interaction I've ever had with him. He took time out of his schedule to show me a shelter that he was operating at the time and to kind of show me the ropes of homelessness in New York City, and just, really a class act. So I hope I didn't embarrass Bobby, and I'll turn it over to him to introduce himself more formally.
Oh, thank you so much, Kelly. And thank you so much, Addie, and for United Way for having us here. It really is a great honor to be here with Dr. Doran. As she said, we go way back. I am based in Nashville. As you mentioned, CEO of the National Healthcare for the Homeless Council. And I like to introduce us by just reading our mission statement. So if you can show that slide. And our mission statement is grounded in human rights and social justice. The National Healthcare for the Homeless Council's mission is to build an equitable, high-quality healthcare system through training, research, and advocacy in the movement to end homelessness. So what we do is we support the 300 federally qualified health centers that have a special emphasis and special funding and special requirements to provide care to people without homes. Now, they meet all of this quality standards of every community health center, but in addition, they have to conduct some type of outreach and have to provide behavioral health services, substance use disorder services, or mental health services. We also support the 100 plus, and the number is growing, medical respite programs around the country. And I'll talk a little bit more about medical respite as a really important innovation and one that California is embracing and is helping to lead the nation around. So by background, I am a health administrator and epidemiologist, and I just love the work that I do, working with dedicated people around the country that are on the front lines, either receiving care at Healthcare for the Homeless programs and medical respite programs, or the clinicians and administrators and advocates helping to deliver the care and help to change the system. So thank you.
Thank you, Bobby, and thank you, Kelly, for those introductions. I already learned so much just in both of your introductions. So that brings us to talking about really the meat of today's discussion and talking about how does homelessness impact someone's health. And to start us off talking about this, I'll give it to you, Kelly, to really walk us through what does happen to someone's health when they're experiencing homelessness, and sort of talking about what is causing, potentially causing that connection. So Kelly, I'll hand it over to you.
Sure. And I'll have to say up front, I mean, this is a huge question. I could spend an hour, probably more, talking about this question, but I'll just point out a couple of things. So first, one thing to note is that even housing instability short of literal homelessness has been shown in research to affect people's health. So, for example, we know that people's housing conditions, if they have like mold or pests in their house, that can lead to things like asthma exacerbations. We also know, from research during COVID that expiration of eviction moratoria was associated with increases in COVID incidence and mortality. So there's kind of a range of things, and then all the way out to what we call chronic homelessness, which is associated even with premature mortality. In general, people who are chronically homeless are dying 2 decades earlier than people who are not homeless. There's a lot of different specific ways that homelessness affects health. I'll mention one. So premature aging, we have good research from Dr. Margot Kuschel and others that show essentially that people who are experiencing homelessness, especially longer term forms of homelessness, age essentially prematurely. So they have rates of things that we call like geriatric syndromes. So things like trouble with their gait, trouble with cognition, issues like that. They have rates of those in their 50s and 60s, more similar to people who aren't homeless, who are in their 70s and 80s. And then the last thing I'll mention, just in this brief intro, and I know we're going to talk about a lot of other issues later on in this in our time together, but I'll just mention, because I think there's a lot of confusion about the relationship between substance use and homelessness. I think a lot of people assume that the relationship only goes one way, right? That people become homeless because of their substance use. And it's true that substance use can contribute to homelessness, though the primary drivers of homelessness are more structural, like lack of affordable housing. But there's also research showing that homelessness itself can affect people's substance use for various reasons, such as people trying to cope with or even can adapt to life on the streets or in the shelter. And it can also lead to kind of people having to sort of put themselves at risk in the ways that they might be using substances. So I just wanted to point out that relationship goes both ways.
Thank you, Kelly, for that insight and for talking about a lot of broad things in a short amount of time. And that's definitely the Orange County has the UCI cost study, which looked at causes of homelessness, and the top 3 causes of homelessness for our community was found to be, number 1 is difficulty finding an affordable place to live. Number 2, difficulty finding a job that pays a wage that allows you to live in Orange County. And number 3 was family issues. So we talk about that a lot in the work that United Homelessness does of the primary causes of homelessness, and how those causes, the initial causes of someone's homelessness can look very different after someone's been homeless 3 years, 4 years, or 5 years. Those two things are 2 different conversations. So thank you for pulling that out. Bobby, I'll hand it to you to see if there was anything else that you'd like to talk about in terms of impact of homelessness on someone's health.
Thank you. I think Kelly did a great job of talking about the direction of what the impact. So I just want to talk about the difficulty in treating someone while they are experiencing homelessness and the impact that has on health. And the fact is, for every health condition, it's more difficult to treat someone who is unsheltered than someone who is stably housed. Just from simple things like, where do you have a place to store your medicine? Do you have a place to refrigerate your medicine? I'm nursing a sore throat, so people say stay home and rest and drink lots of fluids. If you're living in the street or even in shelter, you may not have control over that, the ability to rest, the ability to take care of basic hygiene needs, such as washing your hands, which was one of the top recommendations at the beginning by the CDC at the beginning of this pandemic. So, we're going to talk more about medical respite, but the ability to rest is so important. One of the things, if you're living on the street or even in a congregate setting, it's difficult to get sleep. And there is really, sleep deprivation is chronic among people experiencing homelessness. And I want to remind us that not only does it have bad health effects and bad judgment, it affects our judgment, ability to make good decisions. Sleep deprivation is classified as a form of torture. It's what is done to people to punish them. So we have tremendous problems among that impact the health of people experiencing homelessness solely as a result of their living conditions, that they don't have a place to where they can rest, where they can be safe, where they can ensure quietness.
Thank you, Bobby. Yeah, both of you pointed to something that's very important, is that that health impact, that increased mortality, the premature aging that people can experience when they are without a stable place to call home. And part of the reason we wanted to have this conversation in December was because December is where the longest night is. So for those who are watching who may not know, December 21st is a day that is recognized by communities across the nation, where communities hold events to remember those who have passed away throughout the course of the year, who are without a stable place to call home, who are experiencing homelessness. And those numbers can look different for every community, but for Orange County specifically, this year, as of right now, there were over 380 people who were counted who have passed away in our community. And that is an increase from last year, which was the highest amount of people who passed on record for our community. So it's very concerning to see this have a actual impact on people's health to the point where people are passing away. And we will put into the chat box the two events that are happening in Orange County around longest night of the year, in case you would like to attend. Anybody who's watching would like to attend those. So thank you both so much for your insight on that and talking about what is really an important but difficult question to answer. When we're talking about someone experiencing homelessness, and Bobby, you kind of mentioned this, of trying to access care in terms of trying to access healthcare when someone's experiencing homelessness, I wanted to sort of dive in more into what difficulties do those look like, or what difficulties do people encounter. So Kelly, I wanted to hand it over to you to talk about some difficulties that in your work and your research you've seen people encounter when they try to access healthcare while they're experiencing homelessness.
Yeah, sure. A couple of things, and I'll mention two actually that maybe are not always obvious. One is stigma. So people face an enormous amount of stigma. People experiencing homelessness face an enormous amount of stigma, including when they access healthcare. And many times when you talk to folks that have been homeless and their experiences coming into the healthcare setting, they'll often tell horror stories about how they were treated, how their symptoms were minimized, how people didn't believe them, how they overheard the doctors and nurses talking about how, oh, that person's just here for a sandwich. And, of course, when you've experienced stigma like that in a setting, it would make sense. Like, why would you want to go back to a setting like that? Another thing that sometimes people don't think about is just competing demands on that people have in terms of their time, but also survival. So there was, for example, a New York Times analysis a couple months ago about homeless suites in New York City. And one of the gentlemen who was homeless, who was interviewed, was saying how he can't go to his methadone clinic appointment because if he leaves his belongings on the street, there's a threat that they won't be there when he gets back. And other news stories have reported the same. So people need to kind of keep their eyes on their stuff all the time. That obviously is a barrier to accessing healthcare. And the last thing I'll say is that people often assume that the primary barrier is lack of insurance. And that's actually, in general, not the primary barrier, particularly in states, which is the majority of states that have expanded Medicaid to include coverage of low-income single adults. The majority of people experiencing homelessness in those states do have Medicaid. There are gaps, particularly for undocumented immigrants. But otherwise, the main barriers tend right now not to be lack of insurance.
Really interesting. Thank you, Kelly. Bobby, I know that the work that the council does is very focused on the sort of systemic side of things. So I wanted to see from your perspective, what are these systemic barriers that someone might face while trying to access healthcare?
I think you can look at some of the systemic barriers as what an individual faces, and then we can look at what happens in the healthcare system. But in addition to the ones that Kelly mentioned, transportation is a huge issue and a huge barrier. This is particularly true in rural communities where there's rural homelessness, but it's also true in the cities. I'm from New York, and it could take 2 hours in public transportation easily to get from one part of the city to an appointment. If you are a mother with children, then you face the difficulty to how do I drag my children with me, or do I have a place where I can keep them? So that we take it for granted that people experiencing homelessness have lots of time, but that is absolutely not. Your schedule is not your own, and you have some difficulties. I could not talk about homelessness without talking about systemic racism in our country. The fact is that racial minorities are vastly overrepresented among people experiencing homelessness. And this is directly tied to public policies, federal policies and practices by banks, by communities that were embodied in law and backed up by police forces that force segregation and denial of opportunities. So it's no surprise that 13% of the population is African American, over 40% of those experiencing homelessness are African Americans, or that Native Americans who are dispossessed from their land and opportunities are 2 to 3 times overrepresented among people experiencing homelessness. And I'm so glad that Kelly mentioned stigma and lack of trust. There is well-earned lack of trust among many people experiencing homelessness, not just those who are racial minorities that have experienced discrimination based upon race, but just based upon experiencing homelessness, of looking poor, of perhaps not having access to showers and so forth. So if you're shunned by any system, you will do the natural thing and avoid rejection. So we often refer to some people as being service resistant. No, it's the systems that have not adapted to meet their needs. And that's one of the reasons why in our mission statement say we want to create equitable systems, an equitable health system. What we've been doing in healthcare for the homeless for 35 years is adjusting the systems, our services, to meet the needs, to meet people where they are.
Bobby, that is a perfect segue into the next question I was going to ask is what work is being done to address these barriers and challenges? What can communities do to address these barriers and challenges? So I'll hand it right back to you, Bobby, to answer that.
Sure. Well, thank you. Well, mentioned there are 300 healthcare for the homeless programs, which is one part of the solution. There's at least one in every state. there is also a great need. You also can't talk about homelessness without talking about the need for housing and the need for services. And my good friend in New York said at one point, when we're talking about solutions to homelessness, we're talking about housing and services, everything else is commentary. And we have seen things that have worked in communities. We have drastically reduced veteran homelessness in this country, and the methods were housing and services. We made sure they had a housing voucher and a housing subsidy, and that they had services to get and to stay in there. We can do the same thing. Another solution, which has really been really important for people who have been discharged from hospitals without an adequate place to stay, is medical respite. Kelly started a program in New Haven. There are now more than 100. And I'd just like to talk for a minute and showing 2 slides about what medical respite is. And in general, medical respite is for people who are in a hospital, but that are not ill enough or sick enough to warrant staying in there for clinical reasons, but don't have a safe place to discharge. So medical respite fills that gap. It uses a facility or a service that keeps them safe and provides a safe place to heal. The next slide just shows some of the benefits. It basically breaks the cycle of people being discharged, not healing, coming back into the emergency room, being admitted back into the hospital with more serious conditions, or going into a shelter that can't meet their need, and then they decompensate, and then it makes it harder for them to complete their treatment plan or their housing plan. So California under CalAIM has embraced medical respite as an in lieu of service, or now called community support. This is going live January 1. We've been spending a tremendous amount of our time working with California medical respite or recuperative care programs, as they're known in some parts of California, because these programs have to work well, they have to be supported well, because they improve health, reduce hospital readmissions, they reduce costs to the health system, to society. And there just really is an important tool that we want to see grow. The council formed a National Institute for Medical Respite Care about 1.5 years ago in response really to COVID. So many people were addressing the health needs, and they were looking to medical respite, and we said we need to raise the profile as a solution, and that's been largely successful beyond our dreams. But we know that medical respite is an important tool that every community should have.
Thank you, Bobby, and thank you for the slides. Those are really helpful, and sounds like a really important tool to have in communities' tool belts to address this. Kelly, I'll hand to you to answer that same question. What work is being done? What can communities do to help address the challenges and barriers that people face while they're experiencing homelessness?
Sure, and Bobby covered a lot of it, and I especially just want to wholeheartedly agree with the points he made, particularly around the role of structural racism, and also about how people aren't service resistant. I read, I think it was a tweet probably once by somebody, I can't remember who, that said people aren't services resistant, services are people resistant, and that is sometimes the case. So in terms of other things, I'll just give a little shout out to, there are so many clinicians out there that are doing really important work, bringing healthcare to where people are, including through National Healthcare for the Homeless clinics, but also other work that people are doing with street outreach and street medicine. That all is really important. Respite is near and dear to my heart. In New Haven, we created that respite with really a village of people, including Columbus House Shelter and others. I think in general, just making services kind of more accessible and more responsive to people experiencing homelessness. So one thing that's happened close to home in New York City is that now at a few of our public hospitals, there are special safety net clinics, particularly for people experiencing homelessness, where it's a lower barrier. People don't have to necessarily make an appointment. They can walk in. And also there's really good case management and social work to help people get connected with housing. Because as Bobby mentioned, ultimately the housing is the answer here. So in terms of how to address the health challenges of people experiencing homelessness, number 1, 2, and 3 on my list is to get people housing.
That's great. That is we should use that soundbite in our homelessness 101 classes, is get people housing. We know that housing works, in that cost study that popped into the chat box that shows very similar, that housing is effective. And we talk about that in our homelessness 101 class a lot. So thank you both for talking about what can be done to help address this issue, and prioritizing and focusing on housing as a really important part of that. As we're getting towards the end of our time, I wanted to ask you both, why is it important for communities to recognize, to talk about how health intersects with housing and homelessness? And I'll throw in there an additional question that is, there's not enough, we didn't have time for really, but to throw in there, especially with the COVID-19 pandemic, that really showed how important these two worlds are and how interlinked they are. So I wanted to get your thoughts on both of your thoughts on this question, and I'll give it to Bobby to start us off.
Wow, there's so many ways to attack that. So I'll just do one, and one is, a society is supposed to be concerned about the well-being of all of its members, and especially those that are most vulnerable. And I really look at homelessness, our approach to homelessness, as a moral issue. The richest nation on earth, certainly the most powerful nation, possibly in the history of the world, we have members, our neighbors are on the streets without an opportunity to reach their full potential, to reach a normal lifespan, to reach good health, or to maintain good health. So I look at it as, if we want to improve health, we have to provide housing. Housing is healthcare.
Thank you, Bobby. Kelly, I'll give you the same question.
Yeah, and I'm similarly finding that there's so much to say to this question that I'm not even 100% sure where to start. I mean, in terms of why is it important for communities to recognize how health intersects with housing? And I think one thing, so I sit in the healthcare sector, and I think one reason to kind of bring up this intersection is to bring more people to the table when it comes to advocating for housing, to recognizing this moral health humanitarian crisis that is homelessness in our country. And so that's one reason why I think it's important to recognize. And COVID-19 has just made these connections all the more obvious. I mean, we've seen how the very fact of homelessness has made it impossible for some people to truly stay healthy, to protect their health. And my greatest hope, right, would be that this pandemic has shown us that we really can't have over 500,000 people in our country homeless on any given night. Remains to be seen what happens.
Thank you. That's a really, really two powerful thoughts to end on. And as we come to the end of our time, I want to just quickly say to the people watching that it's some quick reminders about the Longest Night events. These are the two events that are being held in Orange County, and I'm sure if there are people tuning in from other places in California, or folks tuning in from other areas, that there might be an event near you that you can find. And this is the day where our communities are able to remember those that were lost, and recognize and commemorate the lives of people who passed away in the past year without a place to call home. So these are two events that are available in Orange County. That information will be in the chat box, and will also be, you can find these links on our social media, the United Homelessness social media as well. So I just want to say a huge thank you again to Kelly and Bobby for giving us your time, for giving us your expertise, for talking about this issue. I think we'll need to have you both back for another event since this went by so quick, and it could easily be an hour discussion or a 2-hour discussion. And I know that this would be really, our community is really passionate about this issue, and I think we'd love to have your expertise again. So thank you both for joining us today. Thank you to everyone for tuning in. There should be a poll appearing on your screen right now to let us know how you like the event, how we can improve it for next time. And we will also be emailing you out a link to this recording of this event once it's up on YouTube, and it will be immediately available on our Facebook page. So thank you all so much once again, and we will see you in the new year. Thank you all. Have a great rest of your day.